Homes in ruins, destroyed infrastructure and civilians killed as they were waiting for the morning bus to get to work. It's more than a week now since full-scale fighting returned to East Ukraine after months of relative peace. RT's Roman Kosterov met some of the residents who are again adjusting to life under fire.
The humanitarian situation in towns located along the front line has reached a critical level. Civilian areas and city infrastructure is still being shelled as the result of the conflict, and civilians are forced to hide in the basements every time they hear artillery. In Gorlovka, more than 100 people have been killed by shelling in a little over a week, and 317 are wounded. Artillery strikes also damaged 15 schools, a dozen kindergartens, and several hospitals.
I'm 63 years old and I have always worked for my country, but now I feel like I've been discarded like a worn-out glove. I used to be happy about life, but now there is nothing to be happy about.
Town's repair technicians are working around the clock to bring essential services back to life. The families of these men have an added burden to just fearing for their own lives. The task here is to get the electricity and heating back on in the shortest time possible after the shelling.
We had just raised the crane when the mortar rounds started striking the area. The anti-government forces told us to hide in their bunker. When the shelling ended, we came out and fled. We're coming under fire every day, and we have to keep working in these extreme conditions.
The war is certainly affecting everyone, but it's not only the wounded civilians that need urgent medical help. It's also patients with serious illnesses who lack necessary treatment and need near 24/7 medical care. Kidney dialysis is literally a lifesaver. Russia's been providing urgently needed medical equipment for water in Gorlovka, and RT helped deliver it.
If the patient doesn't receive kidney dialysis, he will die. If he doesn't receive enough, he will also die. Unfortunately, some have already died. The lack of necessary materials for kidney dialysis is our main problem.
This hospital initially had over 70 patients that regularly came in for kidney dialysis, but that number shrank by half after the war began. Some were able to relocate and some weren't able to get the treatment in time and didn't survive.
It's lethal if we don't receive it on time, so we're forced to go to hospitals while they're bombing.
There are at least 40 people here in Gorlovka that need kidney dialysis treatment at least 3 times a week. If they don't receive it on time, they will die. However, the road to the hospital itself is also very dangerous as the town comes under constant artillery shelling. So the trip to the hospital becomes a double attempt at survival for the patients. Roman Kosterov, RT, Donetsk region.
Coming up next, the story of the US whistleblowers versus Washington in their struggle to expose the NSA surveillance program.